Greetings. I'm very happy to see you here, and I hope you enjoyed the full presentation under the title Sounds of Music on Julie Andrews and the comments about why it is a mystery concerning neurofibromatosis. Here we are going to take a medical perspective, but perhaps you may wish to refresh your memory of the main presentation. If so, please view it again, and I'll be waiting for you. So let us start. In the main presentation, I pointed out signs that for me are signals suggestive of the presence of neurofibromatosis type 1. I did so in silence, but this time I'm going to offer a clinical perspective verbally. In addition, we are going to emphasize some aspects of medical parlance, and we are going to point out that this short addendum dovetails with a 49-minute tutorial concerned with NF1, which will be described at the end, but I will only mention that it includes clinical videos of real time with patients, some of which were followed by several years, so you can appreciate the dynamic nature of this disorder. So this is a slide you have seen in the main presentation. These are the Mirabelle Palace Gardens, where stand now about 10 of these statuettes of dwarfs. The original collection was much larger. As I point out the signs, there will be an accrual list of what we see, and in red will be shown the actual sign under consideration, while in yellow will be the accrual. So if we look at this statuette, we can see that there is a little fleshy mole that could be a neurofibroma, a cutaneous neurofibroma. Why would the artist include this? Obviously, these are all individuals of short stature. You can see that the proximal end of the limbs is shorter than the distal. This is called rhizomelia. This is compatible with achondroplasia. The head is relatively large, but the face is not very suggestive of achondroplasia because the nose is too well developed for classic cases of achondroplasia. And although you see that the forehead is a little bit prominent, but artists take a lot of levity in what they represent. Here is again a short-statured person with a normal face, not suggestive of achondroplasia, but she does have a fleshy mole that could be a neurofibroma. Notice the location of these things. These lesions are not usually present at this kind of an age nor at this kind of a location. So here's another instance of a mole on the cheek or face, better seen here, and also of a spinal deformity, a severe case of gibbous, if you like, or kyphosis. It is hard to tell from this angle, but in any event, the spine is included in combination with short limbs, and the shortness is more proximal. The neck is barely perceptible. Yet the facial features show a prominent nose, which you rarely would see in achondroplasia. Here is still another case, another short stature person, and you can see this time a large protrusion on the forehead, a dermal tumor that could be a neurofibroma. And in addition, you see a whole distortion of the face, as well as a swelling that is periocular. You can see the asymmetry between this eye, and this could be a plexiform supraorbital neurofibroma. Here we have another case, but is missing the foot and also a gibbous. Let me mention that you can stop the motion at any time to read the contents of each of the frames. Here is one of the most pathognomonic representations of neurofibromatosis in this series of images. This is a saccular lesion. It is virtually unique to neurofibromatosis for two reasons. You rarely will see it without an association with neurofibromatosis. And secondly, this is a very preferred location for this sort of lesions. Another preferred location is the supraorbital space, the shoulder, and sometimes the cheek. Here is macroglossia, which is one of the preferred locations for hypertrophy, for teratomas, and also is seen occasionally, not frequently, but occasionally with neurofibromatosis. So what are we going to do now? Is that, yes, indeed, none of these signs is pathognomonic of neurofibromatosis, but the combination is a different matter. And in the context of this particular saccular plexiform, the diagnosis of NF is virtually certain. What did the artist have in mind? I don't know, and you need to go to the main presentation to hear about it. And I want to point out that artists have trained eyes, contrary to many clinicians, and this is the purpose of our website called the Clinical Eye Openers. Here is a picture drawn about 100 years before these dwarfs were created. And you can see that this artist, Ribera in Naples, represents very, very realistically an instance of saccular neurofibroma and the moles. I also mentioned earlier that when we have these special presentations, usually the themes are hybrids between humanism and medicine. So the humanistic aspect of drawings like this, artists like Ribera, are contained in the companion website called Pandora Word Box. In the clinical eye openers, we have the actual human examples, which is sometimes difficult to post for the general public in the general media. So we are at the end of the medical video addendum to The Sound of Music, The Story of Love, Dwarfs, and a Medical Mystery. You may wish to see the main presentation. Perhaps you didn't see it or you wish to refresh your memory. If so, please see the address shown below. You may also wish to know more about neurofibromatosis type 1. If so, please see next. So we extend to you an invitation to view a tutorial on neurofibromatosis type 1. This is one of the largest known genes in the human genome. It is also one that has the highest frequency of mutations. which can be sporadic about in half of instances. The signs and signals are very numerous, complex, and variable. The diagnosis requires the examination of first-degree relatives, one of the few disorders that has such a requirement. The natural history is of great interest and is unpredictable on the basis of what is the natural history of affected first-degree relatives. The perspectives are complex because this is a high cancer risk syndrome. And so therefore we offer a very large illustrative gallery inclusive of several real-time videos from clinics where the same patient is recorded years apart. So I hope you take this opportunity to learn about neurofibromatosis and its relationship to the story of The Sound of Music. And thank you for your attention, and this time is goodbye until the next time.